This audio series reflects footage recorded from a Meet the Expert series hosted by NayiDisha Resource Center with Dr. Padma Palvai on autism management techniques. Dr. Padma Palvai is a psychiatrist based out of Hyderabad who has experience working with children diagnosed with autism and/or ADHD. For more information about autism, please visit www.nayi-disha.org. NayiDisha Resource Center serves to provide essential information to families of individuals with intellectual and developmental disabilities. It also provides assistance finding service providers and offer peer group support and interaction. Topic discussed in this audio clip: when are medicines effective for autism management?
So, what about medications? Not much. I'll tell you what my medications can't do first, right? They can't improve IQ, language, or social skills. They can't cure your child. They cannot improve the core symptoms of autism. They can't. And it doesn't matter what anybody tells you. It doesn't matter what number of medications anybody gives your child. They cannot do these things with their medications, right? But medications can improve hyperactivity. They can decrease aggression if your child is hurting other children at school. They can decrease that, and they're very effective, and they quickly reduce it. They can sometimes reduce repetitive behaviors. Sleep disturbances respond really well to medications. So we are really good at improving these things with medications. They should always, when I say always, I mean 100% of the time be used along with behavioral treatments. I almost always refuse to give medicine unless you've worked with a therapist for a little bit of time, and especially in a young child. This is how I do it. We have, and I'll tell you why I do it this way, we have very little evidence. When I say evidence, we'll talk a little bit about what studies are and what I mean by evidence, right? See, you don't come to me because you want me to advise you based on what I think or what I've seen in one child that has just walked out of my office. That's not why you come and you pay my consultation fees. You come to me, in my opinion, because I have a certain level of expertise and I have reviewed the literature and I know what is the current evidence. What is the proof? What's the proof that when I ask you to do something, whether it is to give medication, whether it is to do ABA, whether it is not to do certain thing, what is the proof? Your hope and your expectation for practitioners like me should be that we have some reasonable knowledge of what the proof is to what I'm recommending. Is there proof? Is there no proof? Is there any proof, any evidence? When I say evidence, I mean proof, right? Is there any evidence that that particular treatment is going to hurt your child? You want to know these things from your practitioners. It's okay to ask your practitioners these things, right? Don't be afraid. Ask them, because that is our job. I am not going to advise you based on what my nephew did or what my neighbor did on these medications. You have plenty of other parents that you can talk to for that. Why? You don't want to come to me for that. You don't want to go to any practitioner for that. You want a practitioner that advises you based on the current state of evidence, right? And you make the decision whether or not you give that particular treatment to your child. You decide what treatment your child gets. Not me, not Snigdha. We don't decide it. We don't have the authority to decide it. You have the power to decide it. You take our advice and you make that decision, right? So the reason I don't give medications to very, very young children, I almost never give medications, almost never give medications to children under the age of 5. And the reason I don't is we have a dearth of evidence in children that age. We almost have no studies in children that young. And when we do have studies for a couple of medications, we have bad studies, and we'll talk about what good studies are and what bad studies are in a little bit, right? So we don't have any evidence. I don't know what this medicine is going to do to your toddler. I don't have a reasonable idea if it's going to hurt him or help him beyond my own personal experience. And I don't want to practice on your child. Right? I don't want to start practicing on your child, and you don't want anybody else to be practicing on your child. There is very little evidence. So the only time I start talking about medication is if there is some sort of an emergency. Right? I'll give the example of ADHD. Right? In an otherwise normally developing child. Right? The child is so excessively hyperactive that the child is running into the street, and the child has broken an arm and a leg already. And the mom really doesn't have resources to keep the child safe. And there is really not enough time for me to wait and send the child to a therapist and wait for 6 months. Before those 6 months are up, the child could end up hurting themselves again. I will give medicine. I will try medicine with the parent's consent. If the parent wants it, I will give medicine to protect the child. Another situation I'll give the medication is to protect other children from this child. If there are young children in the house, if the child is going to school and the child has already hurt other children, right? And we want to protect other children, and there is no reasonable way we can keep the child away from other children. Or if we keep the child away from these other children, it would hurt the child's development. Then I'm willing to talk about medication. Beyond that, I'm not willing to even talk about medication when I first see a child. And nobody should be, right? Because you don't know what your child can do once they start intervention. I don't know what your child can do. Maybe in 3 months the child's hyperactivity will be reduced. Maybe in 3 months the aggression will be gone. And maybe there is no need for these medications. We don't know that unless we intervene, right? And when we do medication, you want to know, what are we treating with this medication? Because you know not every behavior is going to get better with medication. You know your speech is not going to get better, your child's intelligence is not going to get better. So what are we treating with this medication? Are we treating sleep? Are we treating aggression? Are we treating hyperactivity? Are we treating obsessive behavior, anxiety? What are we treating? Right? You want to know. Because then your doctor should make it very clear, because you want to know what's getting better or what's not getting better. How else are you supposed to know what's not getting better if you don't know what it's supposed to treat? Well, see, the one thing I would say about medications is don't use them indiscriminately. When somebody prescribes a medicine, ask them why it is being prescribed. If they don't tell you, you look into what the evidence is of the medication, right? What are the possible side effects? Is it worth for your child to take that treatment, right? Look into all of this before you give the child medication. And on the flip side of it, don't be afraid to try a medication which could potentially help your child. Far too many parents do not give their children medications that can help them because they're really afraid. They're really afraid that something bad will happen, right? Most of the side effects we know. At least the risks of these medications we know, because we know what the risks of these medications from studies, right? So at least you can make an informed decisions, but not much evidence for complementary treatments.